Şimdi doktor öğretim üyesi Sayın Ünal e, Yavuz hocam konuşmasını yapacak. Kendisi Harran Üniversitesi Veteriner Fakültesi Cerrahi Anabilim dalında spor atlarında nallama konusunda sunumunu gerçekleştirecek. Buyurun hocam. Sesiniz gelmiyor şu anda. Duyamıyoruz sizi. Sol alt köşede mute kısmı var hocam. Hı, tamam.
Evet hocam, şimdi açtım. Ekran paylaştım ama.
Görünüyor hocam.
Tamam.
Buyurun.
Tamam. Hello dear participants, my name is Ünal. I attend from Harran University. I will try to give information about showing on sport horses. Since the hoof capsule is malleable, the manner in which its trimmed and shot can have a marked effect on performance and soundness of the equine athlete. Hoof imbalance, characterized by improper toe and heel length, inappropriate hoof angle, and mediolateral hoof imbalance, is common. Good showing is an art and a science. A person who works as a farrier in sports horses should have a patient personality with hand skills and ability to hammer in blacksmithing practice. For farriers to do their best work, a proper area should be provided and well-mannered horses should be presented. Sport horse farrier must have modern farrier equipment. A fine tool in the hands of a skilled craftsman can be so much an extension of a man's hand that the resulting workmanship almost seems to have flowed directly from the body of the artisan into the work. Personal tools made by farriers are as distinctive as a person's signature. Trimming and shoeing can be categorized as preventive, corrective, or therapeutic. Preventive trimming and shoeing is characterized by balance, support, and protection, and the goals are long-term soundness for performance. Preventive trimming and shoeing should be a part of the routine hoof care program for every sport horse. Corrective trimming and shoeing consists of alterations in the hoof and or shoe to affect stance to stride and breakover. Therapeutic trimming and shoeing is designed to protect or support an injured hoof or limb or to prevent or encourage a particular movement until healing can take place. You should know corrective trimming and therapeutic shoeing according to foot disease and should be able to prepare therapeutic shoes in his workshop. The hoof to be nailed is cleaned roughly in a horse with a healthy hoof. The tissue extending on the side walls of the frog is removed using a hoof knife and mallet. First, the concave sole in the inner region of the white line is cut off, and then the sole located in the outer part of the white line is cut from the heel to the toe. It can be used in hoof knifer for the same purpose. Using the nail knife, excess tissue at the collateral sulci and the central sulcus of the frog are cut off. Measuring the hoof angle, placing and reading the goniometer, the wool sole and then the heels are trimmed in accordance with the foot pastern axis. The correct numbered shoe is adjusted on the anvil and made suitable for the hoof. Farrier can rolling, rockering, and squaring the toe of the shoe if necessary. Positioning the shoe on the hoof, checking the shoe's fit, the farrier should shape the shoe to fit a prepared hoof, not the other way around. The place of the shoe leaf is opened with a rasp. When the farrier is satisfied with the shape of the shoe and the way it sits on the hoof wall, he begins nailing. The nails are hammered out of the white line from the toe to the heels. Driving the nails forth, nailing. After the nails have been driven, the clinches are set or tightened and filed or cut to a short, consistent length. The sharp ends of the nails are cut with nail cutter. Before clinching the nails, clinch pits are opened in the dorsal hoof wall. Clinching is performed by placing the nail heads in the pit using the clincher. The clinches are strengthened by hitting it downwards with a hammer. By rasping the lower border of the dorsal hoof wall, the alignment of the nail and shoe is achieved. After nailing, the hoof is checked in the direction of the balance, length, levelness, sole, frog, shape, symmetry of the hoof pairs. The horse is run and checked for lameness. The balance support and